Congress has returned to center stage, and this time the focus is squarely on Social Security and on the monthly checks that millions of older Americans rely on to pay bills, handle medical costs, and keep their finances steady. In Washington, conversations are underway about changes that could reduce benefits, and those discussions are moving faster than many people realize. Various reports indicate that some lawmakers are backing proposals that would lower or slow the growth of payments for retirees, meaning that if you're not watching closely, the impact could fall directly on you. The obvious question is whether your check could go down, and if that happens, by how much. This isn't just another policy debate. It's about money that people use for rent, groceries, prescriptions, and basic stability. Seniors are already feeling the strain from higher prices. Financial professionals are warning about the potential consequences, and deadlines in Congress are approaching. While lawmakers weigh Social Security's future every year, this cycle the negotiations may lead to concrete changes that show up quickly in your wallet. In this video, we're going to explain what's happening, why Social Security has become a target right now, and what steps you can consider to help protect your benefits. We'll walk through the main ideas being floated on Capitol Hill, look at expert opinions on how they might affect current recipients, and outline practical ways to stay prepared. This isn't meant as scaremongering. It's an important heads up that may influence whether your monthly payment remains steady or faces pressure. Stay with us, because the ideas being discussed could affect your financial security sooner than many expect. Once again, Congress is facing questions over Social Security, and the stakes for retirees could hardly be higher. Social Security is not just one more program. For millions, it is the core of their income, covering basics like housing, food, and health care. Each proposal or negotiation in Washington has a direct link to what arrives in your bank account. This year, the debate is especially intense. Recent coverage shows that some members of Congress are talking about reforming Social Security, language that in practice can mean smaller increases, delayed eligibility, or recalculated payouts. For retirees already dealing with rising medical costs, higher prices at the store, and general inflation, even relatively modest adjustments can ripple through a careful budget. From prescription drugs to electricity bills, every dollar plays a role, and cuts or slower cost of living increases could quickly put additional strain on fixed incomes. Analysts point out that while some of these ideas are described as long-term fixes for Social Security's finances, certain versions would likely affect people who are already receiving benefits. Some proposals would change how cost of living adjustments, COLAs, are calculated. Others would move the full retirement age higher, and still others would alter the core formula used to determine benefits. All of these mechanisms translate into tangible differences: smaller checks, longer waits for full benefits, and more pressure on seniors who are already stretching limited resources. To see why this matters, it helps to understand how the system currently works. Social Security benefits are based on your lifetime earnings record, the age at which you start claiming, and periodic inflation adjustments. When lawmakers talk about adjusting formulas or indexes, they aren't just altering abstract numbers. They're changing the rules that decide how much you receive each month. For example, a slower COLA could mean that your check does not keep pace with your actual living costs, and a higher retirement age could reduce lifetime benefits for people who can't work longer due to health issues or job constraints. The political environment adds urgency. With elections on the horizon, budget negotiations underway, and shifting policy priorities, decisions can be made quickly, sometimes as part of larger budget or spending packages. Changes are often framed as necessary for sustainability, but for people already on Social Security, the result can be immediate anxiety and uncertainty. It's reasonable to want clear, understandable information about what's on the table and how it might affect you. Many financial planners recommend that retirees and those approaching retirement take time to follow these developments, review their own income plans, and think through what they would do if Social Security payments don't grow as expected or are reduced. That may involve checking your benefit statements, evaluating how much of your monthly expenses Social Security covers, and considering possible ways to add resilience to your budget. Ignoring the conversation entirely can leave you unprepared if changes are enacted. At this stage, there is room to explore real-life examples of how seniors have been affected by prior policy shifts, a closer look at current bills and their language, commentary from nonpartisan experts, reminders of past freezes or COLA changes, and practical suggestions for staying informed and advocating for your interests. Congress is, once again, drawing scrutiny for proposals that could influence the size of Social Security checks, which serve as the primary income source for many retirees to cover essentials like rent or mortgage payments, food, medication, and other health costs. For people who've contributed to the system over decades, these payments are not optional. They are central to day-to-day life. Now, lawmakers are evaluating adjustments to the program that could translate into lower benefits for some current and future beneficiaries. This goes beyond campaign talking points. It's a process that could reach your bank account. Reliable reporting from Capitol Hill suggests that multiple ideas are on the table that would affect how much people receive monthly. Some focus on changing the inflation index used to calculate annual COLAs, potentially resulting in smaller year-over-year increases. Others involve gradually extending the full retirement age. Still others consider modifying benefit formulas in ways that might reduce payments for certain income brackets. Any of these, alone or in combination, could mean a smaller check than you might otherwise have expected. These discussions are not abstract. They reflect real choices about how much support older Americans receive. In times like these, understanding Social Security's structure is essential. The program looks at your highest earning years, adjusts for inflation, and then applies a formula to determine your primary insurance amount, which is then adjusted based on when you start claiming. Cost of living increases are meant to help your benefit keep pace with general price levels. When Congress considers changing any of these pieces, formulas, indexes, or age rules, the financial effects can accumulate. A slight reduction in annual COLAs may seem minor at first, but over several years it can amount to hundreds or even thousands of dollars less than you would otherwise receive. For people on fixed incomes, where there is little flexibility, every lost dollar can require a difficult trade-off. At the same time, the cost of living has been rising due to inflation, increases in healthcare premiums, prescription drug costs, and housing expenses. Trimming benefits or slowing their growth against that backdrop could force some families to make tough choices, cutting back on medical visits, delaying medication refills, changing living arrangements, or reducing support for loved ones. Social Security is the anchor of many retirement budgets. When that anchor weakens, the entire financial plan can feel less stable. It's also important to remember that debate over Social Security's long-term finances is not new. Congress has revisited the program many times over the decades. What feels different now is the pressure from demographic shifts and fiscal concerns. With more people reaching retirement age and fewer workers paying in relative to the number of beneficiaries, there's increased urgency in some quarters to act, and some of the options being discussed could take effect relatively soon rather than far in the future. For seniors who don't follow the details, that creates a risk of being surprised by changes. The political conversation adds complexity. Some policymakers emphasize the need to address projected funding gaps to avoid more abrupt changes later, while others focus on preserving current benefit levels and coverage. Many proposals are couched as reforms or modernizations, but the practical result for current recipients can include delayed claiming ages, modified COLAs, or recalculated benefits that feel like cuts. That is why it is so important to distinguish between broad sustainability goals and the immediate impact on people depending on checks right now. Among the specific mechanisms often mentioned are adjustments to the inflation measure used for COLAs, for example, moving to a different price index that grows more slowly, raising the age at which people qualify for full benefits, or changing the formula so that benefits grow more modestly for certain income levels. Each of these tools has clear, quantifiable implications for monthly payments. For instance, if the COLA is based on an index that grows less than the one currently used, your annual raise could be smaller, and over a decade that gap can become quite noticeable. Similarly, raising the full retirement age can push some people to claim early at a larger reduction, especially if they cannot keep working for health or employment reasons. Many experts who work with retirees urge them not to ignore these possibilities. The first step is awareness. Knowing what your current benefit is, what part of your expenses it covers, and how a change of, say, $50 or $100 a month would affect your plans. Reviewing your Social Security statement and any retirement savings you have can help clarify your baseline. From there, advisors often suggest exploring ways to strengthen your position, such as building or maintaining emergency savings if possible, understanding the benefits of delaying claiming if your health and circumstances allow, and thinking about supplementary sources of income beyond Social Security. Staying informed about policy proposals is also crucial. Following updates from reliable news outlets and checking in periodically on official government websites like SSA.gov can help you spot when a general idea evolves into an actual bill with details, timelines, and potential implementation dates. The emotional and practical impact of Social Security changes should not be underestimated. For many retirees, this income is closely linked not only to bills, but to a sense of security and independence. A reduction of even a few $100s per month can cause real stress and force unwanted changes. Families might need to rebalance responsibilities, consider part-time work if possible, or adjust spending on vacations, gifts, or discretionary items to protect core needs like food, housing, and medicine. Although it can feel like individual voices don't matter in federal policy, civic engagement can still play a role. Contacting your elected representatives, asking questions at town halls, and participating in public comment periods are ways to make your perspective known. While this channel is not about politics, it's fair to say that legislators are more likely to think carefully about specific changes when they hear directly from constituents who could be affected. Timing is also important. Major changes to Social Security benefits often move as part of larger budget packages or multi-issue bills, and key decisions can be made quickly near fiscal deadlines. Understanding when hearings, markups, and votes are scheduled can help you anticipate when to pay closest attention. Looking back, Social Security has been adjusted before. Benefit formulas, taxation rules, and COLAs have all been modified at different points in history to respond to economic and demographic trends. Today's discussions are taking place against a backdrop of rising national debt, an aging population, and ongoing budget debates. While those big picture issues are complex, individuals can focus on protecting their own households by staying alert and adaptable. Healthcare is one of the areas most directly linked to Social Security income. Premiums for Medicare, Medigap, and prescription drug coverage, as well as out-of-pocket costs for services, often come out of monthly benefits. Reducing those benefits can quickly constrain someone's ability to pay for timely care. Similarly, housing costs, from rent and property taxes to utilities and maintenance, are ongoing obligations that don't easily adjust downward. Because of this, Social Security is often the bedrock of many older adults' monthly cash flow. Understanding the proposals being discussed, whether they involve cost of living adjustments, retirement age shifts, or benefit recalculations, puts you in a better position to react. Small technical changes in formulas can have significant long-term consequences, so it's wise to review how potential scenarios might play out in your own life. Financial planners frequently recommend concrete steps, such as reviewing your budget with an eye toward possible benefit changes, considering contingency plans, and, when possible, seeking professional advice tailored to your circumstances. Preparing ahead can't guarantee immunity from policy changes, but it can help cushion the impact. Staying plugged into accurate information channels is crucial. Government sources, established news organizations, and reputable advocacy groups can help you distinguish between rumors and actual policy shifts. Knowing which bills are real, what provisions they contain, and where they stand in the process can prevent unnecessary panic and give you time to respond thoughtfully. Families should also remember that Social Security benefits often support more than one person. Spousal and dependent benefits, as well as shared household expenses, mean that any change in one person's check can affect several people. Talking openly with family members about potential scenarios, revisiting shared financial plans, and agreeing on priorities can make difficult decisions easier if they become necessary. In addition to planning, many people choose to participate in advocacy efforts through nonpartisan senior organizations or community groups, which can amplify concerns in a constructive way. Even modest steps, like staying informed, encouraging others to pay attention, and respectfully sharing your perspective with decision makers, can contribute to a broader understanding of how important Social Security is to everyday life. Ultimately, Congress is weighing options that could alter Social Security benefits, and that means staying informed, monitoring developments, and taking proactive steps in your own financial planning are more important than ever. Social Security is more than just a line in the budget. For many, it is a lifeline. By keeping yourself educated and prepared, you can better protect your income and your sense of security, regardless of what happens in Washington. This discussion is for general information only and is not personalized financial advice. Consider speaking with a qualified financial professional about your specific situation.